Imagine waking up in the morning, expecting a fresh start to your day, and the first thing you feel is a wave of nausea. You rush to the bathroom, maybe gag, maybe vomit, and wonder, why does my body feel like this when I'm supposed to be excited about my pregnancy? Morning sickness affects millions of pregnant people worldwide, especially in the first trimester. Despite the name, it's not limited to the morning. It can strike at any time of the day, making daily life unpredictable and exhausting. But to understand why it happens, we need to look at the incredible changes happening inside the body during pregnancy. The key player is hormones. When a person becomes pregnant, the body ramps up production of hormones like human chorionic gonadotropin, estrogen, and progesterone. These hormones are essential for sustaining pregnancy, developing the placenta, and supporting fetal growth, but they also affect the digestive system, the brain, and even smell sensitivity. HCG, in particular, rises rapidly in the first trimester and has been strongly linked to nausea and vomiting. Some researchers believe it interacts with areas of the brain that regulate vomiting. That's why morning sickness is most common between weeks 6 and 12 of pregnancy, the same time HCG levels peak. Estrogen and progesterone also play a role. Progesterone relaxes smooth muscles throughout the body, including the stomach and intestines. While this is beneficial for pregnancy, allowing the uterus to expand, it also slows digestion. Slower digestion means food and stomach acids linger longer, which can trigger nausea. Another fascinating factor is heightened sense of smell. Many pregnant people report that previously normal odors suddenly feel overwhelming. Cooking smells, perfumes, or even the scent of toothpaste can trigger nausea. This heightened sensitivity is thought to be an evolutionary adaptation, a protective mechanism to avoid foods that might carry harmful bacteria during early pregnancy. Morning sickness is also influenced by blood sugar levels. Low blood sugar can make nausea worse, which is why small, frequent meals often help. Similarly, fatigue and stress can intensify the symptoms, creating a cycle where nausea affects eating and poor nutrition worsens nausea. Despite its unpleasantness, morning sickness has some silver linings. Studies suggest that mild to moderate nausea is associated with lower risk of miscarriage. It may indicate that the body is responding strongly to pregnancy hormones, supporting fetal development. Evolutionary scientists theorize that morning sickness may have helped early humans avoid potentially toxic foods in early pregnancy. However, for some, morning sickness goes beyond mild nausea. Severe, persistent vomiting, a condition called hyperemesis gravidarum, can lead to dehydration, weight loss, and nutrient deficiencies. This is rare but serious, and medical attention is critical. Lifestyle, diet, and individual differences also affect morning sickness. Genetics, prior pregnancies, and even the sex of the baby can influence severity. For example, some studies suggest people carrying girls may experience slightly higher rates of nausea, though the science is still evolving. Now that we understand why morning sickness happens, let's focus on what you can do to manage it and make daily life more comfortable. One of the simplest strategies is diet adjustment. Eating small, frequent meals throughout the day keeps blood sugar levels stable and reduces nausea. Instead of 3 large meals, aim for 5 to 6 smaller snacks, foods that are bland and easy to digest, like crackers, toast, rice, or bananas, often work best, especially first thing in the morning. Some people find that keeping dry crackers by the bedside and eating a few before getting out of bed can reduce morning waves of nausea. Hydration is equally important. Vomiting and reduced appetite can quickly lead to dehydration, which can worsen fatigue and dizziness. Sipping water, herbal teas, or electrolyte drinks throughout the day can help maintain fluid balance. Some people respond well to ginger in tea, candies, or capsules, which has been shown to reduce nausea naturally. Peppermint and lemon are also popular for calming the stomach. Timing and environment can make a difference too. Avoid strong cooking odors or perfumes that trigger nausea. Open windows, use fans, or step outside for fresh air when needed. Wearing loose, comfortable clothing can also reduce abdominal pressure, helping you feel less queasy. Supplements can be helpful, but it's essential to use them safely. Prenatal vitamins are necessary for fetal development, but some people find that iron-rich supplements make nausea worse. Taking vitamins with food or at night instead of morning can reduce discomfort. Your healthcare provider can recommend alternatives if standard supplements trigger severe nausea. Stress and fatigue amplify morning sickness. Practicing restorative activities like short naps, gentle yoga, meditation, or deep breathing can reduce stress hormones that worsen nausea. Even light physical activity like walking helps digestion and boosts circulation, which can relieve queasiness for persistent or severe nausea. Medical intervention may be necessary. Medications like vitamin B6 doxylamine or prescription antiemetics are safe for many pregnant people and can significantly improve quality of life. Hyperemesis gravidarum requires professional care to prevent dehydration and nutrient deficiencies. In some cases, IV fluids or hospital care may be necessary. Tracking symptoms can also be valuable. Keeping a nausea journal, noting what you ate when symptoms occurred and what helped, can help you identify patterns and triggers. This information is useful for healthcare providers and helps you adjust your daily routine effectively. It's important to remember that morning sickness is temporary. For most, symptoms peak around week 9 and gradually improve by week 14. Though some may experience mild nausea throughout the first trimester and beyond, the key is patience and self-care, listening to your body, honoring its limits, and seeking support when needed. In addition to these strategies, surrounding yourself with support makes a big difference. Sharing responsibilities at home, communicating with family or partners, and seeking advice from other parents or prenatal support groups can reduce stress and improve coping mechanisms. Now let's address some common myths and lesser-known strategies that can make a real difference during morning sickness. First, the myth that you must eat only certain foods is misleading. While bland foods are often easier to tolerate, the most important factor is what your body can handle. Some people find that small amounts of protein, like eggs or yogurt, help stabilize blood sugar and reduce nausea. Others tolerate complex carbohydrates better. Listening to your body and experimenting safely is key. Another myth is that morning sickness is purely psychological. It's not. The hormonal changes we discussed earlier have a real physiological impact. But stress, anxiety, and fear can amplify the sensation. That's why mindfulness, relaxation exercises, and supportive counseling can improve symptoms in many cases. Let's talk about acupressure and wristbands. Some studies suggest that acupressure on specific points on the wrist can reduce nausea. These wristbands are non-invasive and safe during pregnancy. While they don't work for everyone, they can be a helpful complement to other strategies. Food pairing is another useful tip. Eating small snacks before or after certain foods can help. For example, pairing dry crackers with little protein or drinking fluids separately from meals may reduce queasiness. Cold foods, like smoothies or chilled fruit, often trigger less nausea than hot meals with strong aromas. Timing and positioning can help too. Avoid lying down immediately after eating, as this can worsen reflux and nausea. Instead, try sitting upright or gently walking to aid digestion. Sleeping with your head elevated may also reduce nighttime discomfort. For people experiencing hyperemesis gravidarum, early medical intervention is crucial. This condition can lead to serious dehydration, electrolyte imbalance, and weight loss if untreated. Anti-nausea medications, IV fluids, and dietary adjustments are safe and effective under medical supervision. One key point is that morning sickness rarely harms the baby. Studies show that, in most cases, nausea and vomiting are signs of a healthy, hormonally active pregnancy. However, severe cases that prevent adequate nutrition need careful monitoring to ensure fetal growth and maternal health. Pregnancy is a time of incredible change. Morning sickness, while unpleasant, is part of your body adapting to support new life. By combining nutrition strategies, hydration, rest, gentle activity, stress management, and medical guidance, you can manage symptoms effectively while keeping both yourself and your baby healthy. Finally, remember that every pregnancy is unique. What works for one person may not work for another. Keeping track of symptoms, staying hydrated, eating what feels tolerable, and seeking medical advice when needed are your best tools. Morning sickness is temporary. With awareness, care, and support, you can navigate it successfully, ensuring the early weeks of pregnancy are as comfortable and safe as possible. Morning sickness is one of the most common experiences in early pregnancy, yet it can feel overwhelming, exhausting, and sometimes even discouraging. The waves of nausea, the sensitivity to smells, the sudden urge to eat or avoid certain foods, all stem from the incredible changes your body is undergoing to support new life. While it can be uncomfortable, it's important to remember that morning sickness is usually a sign that your body is functioning as it should. Hormones like HCG, estrogen, and progesterone are working hard to nurture your baby even if your stomach protests. The key is balance and self-care. Small, frequent meals, staying hydrated, managing stress, gentle activity, and safe remedies like ginger or wristbands can make a huge difference. When symptoms are severe, medical help is available, from safe anti-nausea medications to IV fluids in rare cases, ensuring both you and your baby remain healthy. The first trimester may be challenging, but it's also a time of amazing growth and transformation. By listening to your body, respecting its limits, and taking proactive steps to manage nausea, you can navigate morning sickness more comfortably and confidently. Every meal, every sip of water, every moment of rest is a step towards supporting the new life growing inside you. Morning sickness may be temporary, but the care and attention you give yourself now will have a lasting impact on your health and your baby's well-being. Remember, you are not alone. Your body knows what it's doing, and with awareness and support, this phase of pregnancy can be managed safely, one wave of nausea at a time.